Good morning, everyone. My name is Sarah Winke, and I was in a group with AJ Franzman and Erica Nickel, and today we are going to talk about yellow fever virus, as that is what you've just been diagnosed with. So, before we get into all the logistics about it, we're going to talk about what is yellow fever. So, it's found in Africa and South America primarily, and it's spread through a mosquito bite. And basically, the mosquito injects that virus into your body. And you are extremely rare, as you're one of the less than 1,000 cases in the US per year. And the overall effect of this is going to be your liver, kidney, heart, and gastrointestinal system. We'll get into that in the next slide here. So when you came in today, these were some of the symptoms that we were looking for. And your symptoms won't usually appear until 3 to 6 days after you're infected. So we're looking at fever, jaundice, which is kind of like the yellowing of like your eyes and your skin, and that picture up there kind of explains that a little bit better. Muscle pain, backaches, headache, loss of appetite, nausea, vomiting. Those are all things that we were looking for as you came in this morning. To assess this, we're going to do a physical exam. So we're going to look for those symptoms on your body. We're going to see if there's anything else that has developed. We're going to look for a mosquito bite potentially. And then we're also going to ask you, which is the most important question, if you've traveled to South America or Africa. And if you look on this map here, you can kind of see the areas in yellow there that you would potentially be getting yellow fever from. So now to causes. So this is a mosquito virus, and basically how a virus works is it takes over the cell that it infects. So it basically uses your body as a host. And this mosquito was infected with this virus, and when it landed on you and injected its saliva in you, it traveled into your bloodstream, and then it can go pretty much anywhere it wants to within your body. And this little cycle down here with all the monkeys and the humans, it's just basically showing that those are the two types of people and things that the mosquitoes bite, which are monkeys and humans, and it's just kind of like an endless cycle. And so this is what caused your virus. Diagnosis is a little bit difficult because it does kind of look like other hemorrhagic fevers, and so we kind of have to look a little bit further to diagnose specifically yellow fever. So again, we're going to do that medical and travel history, and you did travel to Africa in the last week or so we do know that yellow fever is on the top of the list of what we should be looking at. And then a blood sample is really important because we can look at your blood under a microscope and we can see that your cells have been infected with that virus. And so that's just going to be the main diagnosis part. Don't know why there's not any things up there. Can we quick pause?
Yeah, sure.
I guess it.
Are you able to email me at real?
Yeah, I'll try to email you.
That's unfortunate.
I know Wi-Fi is terrible. What's your email again?
My name's Lindsay, so it should pop up.
Is it Lindsay? It's not popping up. Ewald?
Ewald, yeah, try that.
At Georgia EDU?
Yeah. And then Lindsay.Ewald and then
Yep.
S-A-Y.
There it is. Okay. Okay.
Let's see how fast mine load.
Oh, there it is. Okay. That's weird.
Yeah, that was very helpful.
We did submit it twice, so maybe it just didn't.
I've had that with other groups that go away.
Do you need a code from me?
No. Let's try this here.
Otherwise, I can just plug in my code.
Should do it.
right, so now into treatment. Basically, you can't really cure a virus with a bacterial infection. You can do antibiotics, but since this is a virus where it's taking over the cells in your body, there's no specific cure. But there are 4 things that we can do. We're basically going to admit you to the hospital, and we are going to provide fluids and oxygen to keep you hydrated and have all the right things flowing around within your blood to try and attack this thing. And then we're going to monitor your vitals, which are basically the main things that are keeping you alive, and that's what this machine is doing here. We're just going to make sure everything's at a normal level. We're going to do dialysis if kidney failure does occur, which is unlikely as your symptoms are not super severe, but we're still looking out for that. And then you could receive some plasma transfusions just to help with getting back onto your healthy state and helping your body recover. And now for prognosis and follow-up. So 85% of people diagnosed with this are going to fully recover. And this is what we suspect you will have your prognosis be, just because your symptoms are not as severe and you seem to be doing pretty well already as you've just been diagnosed. And once you do recover, you will have immunity, which is kind of cool. So you can really travel wherever and not worry about the yellow fever virus ever again. And the other 15% of people diagnosed are going to probably have some more severe cases, which again is not what we think you have, but they're going to need some further treatment. It might take longer for them to fully recover, and so on. And finally, you're going to want to do appointments needed with your symptoms. So if you're in a lot of pain, come on in and we'll get you some pain meds, things like that. We just don't want it to progress to a severe state if it doesn't have to. So come to your follow-ups and you should be all set to go. And these are our sources, so if you have any more questions, you can let me know or let one of your doctors know.